have a friend and a senior. So he has been suffering for the last maybe a year or so. Since 1 year, he is just not able to be himself. He is not able to get up from his Indian toilet. He is not able to run up the stairs. He was not able to actually he's a surgeon, so he was not able to hold his hand in a particular position for a long time. He had to take rest. And he assumed that this could be just because he is getting older. He assumed this and continued to go on with his daily activities till one day it really became bothersome. It became so bad that he could not get out of her western commode that day. He found it really difficult to get out of the chair from the western commode and walk out of the toilet. So that is when he realized that something is wrong and I need to seek some advice. And he met a neurologist because he thought there is some kind of a weakness, and the neurologist did a lot of tests and then found that his muscle enzymes were elevated, and then finally referred him to a rheumatologist. Imagine, he is a doctor and he had to go through all this before he could reach a rheumatologist and before he could reach a diagnosis. So what we are talking about today is an interesting autoimmune disease called inflammatory myositis. Inflammatory myositis, as I already mentioned, is an autoimmune disease. Yeah? Autoimmunity means your immune system starts to attack your own organs. In this case, it is predominantly the muscles. So this autoimmune disease causes inflammation of the muscles. That is why myo, that is muscle, itis means inflammation, myositis. So let us try and understand more about an inflammatory myositis or inflammatory myopathy, or it's also sometimes called as idiopathic inflammatory myositis, IIMs. It's also called as, there are subtypes of IIMs called dermatomyositis, polymyositis, antisynthetase syndrome, necrotizing myopathy. So a lot of things, we don't have to get confused, but these are all grouped under something called inflammatory myositis. So who gets this inflammatory myositis? So inflammatory myositis typically has two peaks. The first age group is children. Children of 4 to 8 years is when these children develop myositis, and this is called juvenile dermatomyositis. Yeah. After this peak, the second peak would be after their 40s. Yeah. Having said this, does not mean that people between these age groups do not get myositis. As specialists, we often see people between these age groups too. But if you ask me, commonly 80% of the people are either a juvenile dermatomyositis or those who develop myositis after their 40s. Among men and women get myositis more often. Maybe the ratio is about, for every 4 women, we have about 1 man with a myositis. So now let us try and find out what could be the signs and symptoms that would prompt you to get to a rheumatologist for myositis. If you look at the signs and symptoms, as the name says, inflammatory myopathy, it means that muscles are involved. So if there is muscle weakness or muscle involvement, what will happen? The symptom would be that you are not able to do activities where you have to lift your hand above your head, or you may not be able to do activities which involves your proximal muscles or muscles of your thigh, like climbing up stairs or getting up from a squatting position, or maybe in very advanced stages even walking would be difficult. But the good thing is, in early stages your finger muscles will be fine, your toe muscles will be fine, your feet will be fine. So this is something called proximal muscle weakness, proximal being your arms and your thigh, and weakness in these muscles. Along with this, there can be pain in the muscles, and sometimes there can be swelling in the muscles also. So myositis, in this, the first and commonest symptom will be muscle weakness. The second commonest symptom, if you ask me, is usually a skin rash. You would attribute it to so many medicines that you have taken. You would say that I had that allergy because of that medicine. These skin rashes are quite classical. If a rheumatologist sees it or if a dermatologist sees it, they will never miss it. So these skin rashes can be seen around the eyes, something called a heliotrope rash. It can be seen in places where you wear a shawl, it's called a shawl sign. It can be seen in places where your V neck exposes your body, it's called a V sign. It can be seen on the knuckles, called the Gottran sign. It can be seen on your fingers, called mechanic's hand, or it could just be throughout your body that you have generalized itching with increased darkening of your skin, and especially this itching gets bad when you go out in the sun. So skin lesion is another classic finding, especially in dermatomyositis. Beside this, we can also have joint pains or arthritis. See, arthritis can come in myositis also, inflammatory myositis. So joint pains will be involving your finger joints, your elbow joints, your knee joints. It can involve multiple joints. With pain, there can be swelling. So arthritis is the third most common symptom. Fourth would be fever. People with inflammatory myopathy can have low grade fever which is going on for 2-3 months, not knowing what to do, not getting any cause. We have already taken so many medicines for it, but it is not disappearing. So fever could be another unexplained fever. In fact, unexplained fever can be another symptom of myositis. And the fourth one would be involvement of your lungs. This is a very important organ involvement in myositis, especially in a subgroup called antisynthetase syndrome, wherein your lungs get fibrosed, and it is called interstitial lung disease. And treating this can have excellent outcomes if picked early and treated aggressively. So what can be the symptoms if the lungs are involved? You could have breathing difficulty, especially when you walk for a little distance. You could have cough without any sputum production. You could have just some chest pain and discomfort. So all these things can be signs that your lungs are involved. So what can be involved? Muscle weakness, skin problems, joint pain, lung problems, and fever. These are the commonest symptoms somebody with inflammatory myositis can have. So doctor, is myositis one thing or are they different things, if you ask me? So myositis is generally considered as a combination of different similar diseases. First being the dermatomyositis, where along with muscle disease you also have skin lesions. That is why dermatomyositis. Derma means skin, myositis means muscle. Second would be antisynthetase syndrome, wherein along with the skin and muscle and joint, you would also have lung involvement, which is very prominent. So antisynthetase syndrome. Then there can be something called a polymyositis. So polymyositis does not have any muscle, any skin involvement, no lung involvement, but they can have lot of muscle weakness. And finally, something called an inclusion body myositis. This kind of myositis is usually seen in a little elderly population above 50-55, and here the quadriceps muscle or the thigh muscle is the most important involved muscle, and they keep tripping and falling. This will be their common symptom. So this is another form of a myositis called inclusion body myositis. Alright doctor, fine. So you have told me about everything. How do you diagnose this? Diagnosing this, like any other autoimmune disease by a rheumatologist, would be based on your clinical features first. Your rheumatologist will see what are the organs that are involved, how much of muscle weakness you have, then will come to a conclusion that this could be inflammatory myositis. And then they would take a series of blood tests. First, to confirm that there is muscle inflammation, they will do your CPK, creatinine phosphokinase, or LDH, lactate dehydrogenase. These are the two tests. Along with this, even our liver function tests like AST, ALT, also known as SGOT, SGPT, can also be deranged in these patients. And this is not because of a problem in the liver, it is because of inflammation in the muscle. So this also can give a clue to a doctor that there could be myositis. Then to look at the extent of muscle weakness, they might do MRI of your muscle, especially of the thigh, or they might ask you to do a PET scan of your whole body, where it can pick a lot of muscle inflammation and also give additional information. Along with this, one important thing that patients with myositis have to know is that people with myositis have a higher risk of some cancers. That is why a rheumatologist will very extensively search for cancers. They will do a CT scan of the chest, they will do a CT scan of the abdomen, or they will do a PET CT of the whole body. So with all this, they will be able to rule out a cancer if there is any, because that will need treatment earlier if there is any kind of a cancer. And the next set of blood tests would be to confirm the type of myositis. Here they will do something called a myositis specific antibody, MSA, also called as myoblot. So with this, they will get to know that what is the autoantibody you have, and with this autoantibody, what is the likely type of myositis you will have. Finally, what is the treatment for myositis? For treatment for myositis will be a combination of immunosuppressive drugs. It could be a steroid or a IVIG with a steroid sparing agent or a disease modifying agent, like methotrexate, mycophenolate mofetil, or even sometimes rituximabs. Sometimes even drugs like cyclophosphamide is used if the lung condition is bad, or if the patient's situation mandates use of such higher drugs. But the most important thing with myositis is lifestyle modification or exercise, because it has been found that doing exercise is as important as taking these medications, if not more important. So your doctor will have or will give you a tailored exercise regime which will fit your current fitness standard, and then slowly progress over time to make you stronger and stronger. So myositis is an autoimmune disease, but it has to be picked early and treated aggressively for best outcomes.